For our final presentation of the afternoon, we're going to hear from Hannah from the University of Sydney, talking about attitudinal barriers to psychological support seeking among carers of people with a chronic physical health condition.
Okay, hi, can everyone hear me okay? Wonderful. So my presentation is going to be looking at what is stopping carers from seeking psychological support for themselves, specifically focusing on some of those attitudinal barriers to support seeking. And I would like to thank the Psycho-Oncology Cooperative Research Group, as well as my wonderful PhD supervisors for supporting me in this project, as well as my PhD as a whole. So I think we can all agree that carers play essential roles in the support of people as a whole, particularly for my studies and research for people with chronic physical health conditions. So around 1 in 3 Australians have some type of chronic physical health condition. And we know that carers have significant physical, financial, social, and psychological challenges. But I will be focusing specifically on the psychological impacts of the caregiving role. And we know that compared to community norms, carers typically demonstrate higher levels of distress, anxiety, and depression. However, we know that support services can help with these interventions, but we often see a treatment engagement gap where carers are reluctant to actually access support for themselves. And even when there's high levels of distress and they say that they want support, they're not actually reaching out and connecting with the services that could help them through some of these challenges. So there are plenty of things that contribute to this gap, and they're things that we are well aware of and we have discussed plenty today. We have systems factors, we have carer identification factors, we have societal factors, the fact that, carers are often overlooked, and we've talked about many of these things today. We have individual factors, time constraints, practical barriers. But one of the things that I wanted to focus on specifically is that even if all of these kind of factors were addressed and resolved, there may still be attitudinal factors that can stop carers from actually accessing that support for themselves. And a really key thing with the attitudinal factors is that unlike kind of these systems and societal factors, while it would be lovely to be able to fix them all, they're not necessarily amenable to intervention, whereas those attitudinal factors can be something that we can address in somewhat more immediate time frame. And before we go on to kind of try and address those things, addressing interventions, all of those sorts of things, we want to make sure that we have a really comprehensive understanding of what is actually contributing to these attitudinal barriers. So my first study of the PhD that I conducted was looking at the individual factors and conducting a systematic review about the attitudinal barriers to carers of people with a chronic physical illness seeking formal psychological support for themselves. So in terms of the studies that I included for this review, I was looking at studies from January 2005 to 2025, qualitative studies, and I chose qualitative studies specifically to get just a richer understanding of what those attitudes are, something that can kind of be overlooked in quantitative research. Looking at formal support services, so not social, informational, or anything like that. We're looking at counselling, psychology, support groups, those sorts of things. Adult carers caring for another adult with a chronic physical health condition, so cancer, stroke, cardiovascular disease, those sorts of conditions. In terms of screening, this was a meaty systematic review. So we searched 4 databases, had over 10,000 studies, and spent a while trying to whittle this down. But there was just a reflection on the disparity of the literature in the area, about 180 odd full texts, and we landed with 31 included studies, so 26 qualitative and 5 mixed methods studies. Really quick overview of the studies that we included within the review. Most of the studies were from Western countries, as is commonly seen. About 3/4 or more than that actually were semi-structured interviews. And then the majority of carers, unsurprisingly, were female and spousal or partner carers, which is just a reflection of a lot of the research that we've talked about. So in terms of the conditions that were included, the majority were cancer conditions. And then also the primary support service that was discussed was psychology or counselling. So about half of studies had that as the main focus. In terms of the analysis that we did a qualitative metasynthesis. So this involves extracting quotes from all of the relevant studies, and then we did coding of those quotes and then put them into categories and themes and sub-themes. So similar to a typical thematic analysis, but at the broader level within the studies. And then the results themselves, there were 3 key themes that we had, and at a really broad level. Those key themes that we had were attitudes related to the services themselves and mental health as a whole, attitudes that were either about or kind of derived from the systems that carers are currently within, and then finally, attitudes about carers themselves, about their needs and their role as a whole. So the first theme was that stigmatized beliefs about mental health and psychological support services. So they could listen to me, but what could they do? And within this theme, this is where I'm going to get my notes up. Within this theme, what we found was that many carers actually had these stigmatized beliefs about mental health support services. And so they saw that there was this perceived futility about these mental health services. So they didn't actually think that the support could help them. So you've got can someone look after her for 5 minutes? That's support to me, not all that emotional rubbish. You've got overall attitudes towards mental health as a whole and the stigma associated with seeking support for yourself. So seeking support to me is a sign that you're a needy person, and I don't like that picture of myself. But there were also these kind of misconceptions about what psychological support involved. And so for some carers, there were these kind of fears around or trepidation around what would be involved in the support, not wanting to unpack all those emotional things. So I didn't really want to go through the emotional things. I'm a little bit scared of what you'll find. So they didn't want to go to support groups and hear other carers' stories. They didn't want to hear about what would happen if someone was caring for someone who passed away, or they were kind of worried that it would unravel this sense of control that they had. And so then there was that reluctance that was there, and that was compounded by poor previous experience with support seeking, biases against mental health professionals as being kind of unfeeling or detached and things like that. And then also fears around medications in particular that was raised in a fair few studies where carers were worried that if they weren't in sought support, they would just be put on medications and would become addicted. So kind of the mental health literacy was a bit of a challenge here. The next theme had to do with systems, so attitudes that were either derived from or about the system. So it's this idea of how carers felt in these patient-centric systems that we have. So it was never about me. So with this, the first sub-theme had to do with this perceived lack of carer-focused services. And so what we found was that carers didn't really think that there were services out there that would address their specific needs. So you've got a lot of what's out there isn't really designed for families, or the counsellor's got no idea, unless you're going through this, you've got no idea how it feels. And so these more general services weren't seen as a useful kind of time that carers have, and they're time limited as is. They didn't want to go to general services or a general counsellor and have to explain what dialysis was, or have to explain what their caregiving situation was, or the time burdens that they were going through. They wanted something we need psychological support from someone who knows the condition, someone experienced. And so even on that, when carers were willing to access these more general services, what they found was that they had this lack of information about where they could actually go and how to actually access relevant support. So again, coming back to a little bit of the health literacy things, but on almost the more practical level of, okay, if I want support, where do I actually even go? And so there was this overall desire for highly tailored support that could actually be flexible, accessible, and address carer-specific concerns for what they're going through, which is something that we've discussed plenty today and has been brought in other presentations. The next sub-theme had to do with the role of health professionals within carer support. So similar to the services themselves, carers felt that many health professionals didn't actually focus on the carer. They were focused on the patient. So your story is not seen, you're not actually addressed. And so within a couple of the studies, there were actually perspectives from the health professionals. And what we found was that health professionals didn't necessarily see carer support as part of their scope of practice. And so things like, we can't be the carer's doctor. And the other quote on the far left was actually a carer who had gone to see her GP for psychological support and to get a referral. And then I pretty much got told, why are you coming to me? So it was either that carers weren't seen as important, focused on the patient, or mental health support as a whole was kind of disregarded and off to the side. And so even in that, health professionals were typically more inclined to refer carers to practical or patient-centered services that would help carers assist like in their role and the practicals of the caregiving and the medical care and all those sorts of things, as opposed to mental health support that would specifically address their needs. And so there was that desire for actually proactive rather than kind of ad hoc or superficial support, or even just actually recognition as a whole, to even be recognized within a consultation as like the role that they have and the impact that this may have on them as a family or friend. Final theme, and this was the kind of crux of the review, was the perceived validity of carers' own needs. So I sometimes feel like it's unfair to ask for help. And so one of the most prominent reasons that carers would not seek support for themselves was this dismissal, deprioritizing, and kind of overall devaluing of their personal needs as a carer. And then one of the most common things was this comparison to others. So they would compare their needs to the needs of the patient, or they would compare their needs to the needs of other more legitimate carers. So things like, my problem isn't as bad, or I wouldn't like to derive resources from people that are actual kidney patients that may need support 10 times more than I do. And so they didn't necessarily believe themselves to be deserving of support. And it kind of elevated that threshold for seeking support, where seeking support was left for if, you know, it got really bad, like if they were contemplating suicide, or seeking support was only for carers who were 24/7 carers, especially for people with like lower grade cancers or things like that. It was like, no, that's for people whose child has a disability or something like that. And so the other thing was that it was sometimes coupled with this survivor guilt, where it was like, because I don't have any health conditions, I feel like I shouldn't need this type of support. And then the next sub-theme had to do with carers' role perceptions. And so overall, there was this perception of carers as these pillars of emotional stability and strength. And so this kind of almost hero role. So I tried to be the hero, and it doesn't fit the role of a hero to participate in a help program. And so seeking support was not only seen as a luxury, but also contradictory to carers' roles. And so, you know, to some cases as well, carers would acknowledge their need for support, but would deliberately set those needs aside to prioritize the needs of the patient or remain committed to that caregiving role. So the idea of the main thing is to put yourself in the background. That was what carers thought their role was. And I guess it all comes back to that kind of broader societal idea of, we still have an expectation in the community and on ourselves. The person who is sick, who isn't sick, is the one who just keeps getting up. And so it was interesting, actually, in 2 studies, carers were so committed to that caregiving role, to that need to be strong, that they actually denied their need for support, even when it directly contradicted distress screening results. They would see the results and be like, no, but that can't be right. No, that's okay. I still don't need support. And so we wanted to kind of actually figure out how all of these kind of themes and ideas fit together. And so we developed a model of how all of these things fit together to contribute to those low levels of psychological support seeking. So as you can see, on the either end, you've got these kind of pre-existing, often stigmatized or erroneous beliefs about mental health, support services, and the perceived validity of carers' own needs. And these beliefs were shaped within kind of patient-centric healthcare systems where carers felt overlooked or unsupported. And so more specifically, you can see on the far left-hand side that the lack of carer-focused services kind of fueled and reinforced the idea of like the perceptions about the inadequacy of mental health support. And then on the other side, you can see how the comparison to others' care role perceptions and the typical idea of being overlooked by health professionals kind of fueled ideas about carers' needs not actually being valid. And then finally, down the bottom with the dotted line, the interaction between mental health stigma and carer role perceptions kind of fueled together to contribute to the low support seeking. So carers thought that seeking support was weak. There was that mental health stigma. They also thought that their role was to be strong. And so the two interacted. And so they're going to avoid support seeking. And so all of this contributes to the low use of psychological support services. And so I guess in terms of where to from here, we kind of have this idea of this two-pronged approach. So at a systems level, there's a need for legislation and support to go beyond simple recognition of carers, but actually broader system level acknowledgement, incorporating within patient care, all of those sorts of things, ensuring services are actually carer informed, and then also training health professionals in how to actually acknowledge carers. And I think there is the importance of acknowledging that health professionals are incredibly overburdened and have high workloads as is. So it's not a matter of then completely deterring all patient care and focusing it on the carers, but actually just priming health professionals and training them to just have the idea in the back of their head of even just a simple acknowledgement of looking a carer in the eye, acknowledging that this may be tough for them too, and that they can seek support for themselves. Like that simple 30-second recognition actually can go a long way for carers. And so then at the carer individual level, actually addressing the attitudinal barriers, and then looking to increase health literacy and self-compassion. And so this can be educating carers about the scope and purpose of available services, reducing mental health stigma, shame, and social comparison, helping carers acknowledge their role and how it may actually influence their behaviours, and also helping carers navigate that tension of recognizing their needs while still performing their caregiving duties, not completely dismissing the patient and not completely dismissing themselves, but actually finding the balance between the two. And so I'm aware that I'm running out of time, but we are basically using all of these things to develop a resource called Carers Can Access. And so within this resource, we're addressing attitudinal barriers and basically then helping carers actually identify different types of support options that are available. And then with that as well, helping with the practicals of, okay, these are some attitudes that you may have. They may not necessarily be the correct. These are some support options that are available. And then how can we help you decide which actual support is best? So looking at their values and needs and the context that they're in, and then the practicals of how do I do that? So that is all from me. Any questions?
Thank you, Hannah. Any questions? Nick.
Great presentation. I generally just had some thoughts about it. Like as somebody that I went and got, my sister's a psychologist, and it even took me like months to go get counselling when I was like a carer. But I obviously went through like Carer Gateway. So I suppose, are you planning on like when you do the, what was it? The Carers Can Access?
Yeah.
Are you going to start looking at like the system as a whole and where services are actually available?
Yeah, so we're in the process of actually then developing. So we're about to prepare for doing some interviews with health professionals, clinicians, policy workers, all of those sorts of things to actually help with the content of the intervention itself. But at the moment, we're looking at the bigger picture things of like, okay, you've got more government organisations, Carers New South Wales, Carer Gateway, you've got kind of more community, local support, your local GP having a conversation with them. You've got more clinical services like clinical psychology. Also acknowledging the fact that for some carers, social support is sufficient, but like it's still that important of priming them to be like, hey, okay, social support may be okay at the moment, or okay, Carer Gateway may be a great avenue for you to go through and kind of directing them through the paths, but just priming them to be like, your needs may change over time as well. And so this may be what you need at the moment, but you may need something different a month, 2 months. There may be a recurrence within the person with cancer and you may need the extra support. So just trying to help them with the practicals of that. But Carer Gateway, Carers New South Wales, bigger picture things are definitely going to be included.
And my second question, when you're looking at the or did the analysis, so you said that it was from 2005 to 2025. Did you look to see if trends had changed over that time through the research papers?
We didn't look at it so much, but what we did find is that, I can't give you the specific number, but the majority of studies were in that 2020 to 2025 bracket of there was like this massive like incline in research. And then even then, I think part of what took it so long and why it was so meaty was that there were very few studies that actually focused on the topic specifically. We were like searching through papers. And if there was like one line within a tiny sentence of a theme that was like, oh yeah, carers didn't want to actually seek support for themselves. And then there was a quote, we were like, done, we'll take that. So we picked 2005 just because of like the lead up to a lot of the policy changes and things like that in those early 2000s. But yeah, there's definitely an incline in research, but there wasn't enough to see trends.
All right, thank you.
Thank you. Any other questions?
Thank you so much for the presentation. I was wondering what was your search term for the meta-analysis?
That was a meaty thing. We had kind of main categories. So you had carer, support person, family, friend, psychological support services. They are main ones, but and the conditions. Thank you. I was like, there's another one, and then the conditions themselves. So yeah, carer, support service, psychological, health condition, and then there was a lot that we had to go through to try and find all the different combinations of what people use. So yeah.
Thank you.
I'd love to read it. Are you publishing?
It is currently under review. So, and there is a sister paper with that. So we did a quantitative paper as well, looking at the prevalence of support seeking, as well as the associations like on demographics level. And both of them are currently under review. So let you know.
Good luck with that one. In that third theme, you were focused on beliefs about accessing services.
Yeah.
I just had an idle question, which was,
Yep.
in that literature, did any of it come up or touch on the issue of what carers believed that the person being cared for would believe if they learnt that you accessed that service? I could imagine a range of scenarios where that
Yeah.
might complicate the relationship and...
Yeah, I think there was some stuff around within the mental health stigma about what other people would think of me, and that somewhat encompassed the patient, broader community, including the patient. I don't know if carers were necessarily going into the, I can't remember any specific quotes or things like that of carers being like, oh, I'm worried of what they'll think of me, or I think it was more a matter of, I'm so focused on prioritizing the patient. My biggest priority is that they need me at the moment and I need to be strong. And so I can't seek support for myself. No. So.
Thank you, Hannah.
Wonderful.